Welcome back, focused learners. Today, we're diving into a massive shift in public health policy. We're looking at a landmark legal mandate that's basically designed to completely change how a nation maps and fights a major health crisis. This explainer, it's all about data, early detection, and honestly, how transparency can literally save lives.
Okay, let's jump right in with a really crucial number, 19. This one number represents the massive scale of a recent Supreme Court order. The highest court has explicitly targeted 19 states and union territories with a singular sweeping public health directive. So what exactly are they demanding from almost 24 regional governments all at once? Section 1, the Supreme Court mandate. So here's the deal. The Supreme Court has officially asked these 19 states and UTs to declare cancer a notifiable disease. And the goal here is crystal clear, to ensure early detection. This is the absolute core of our explainer today. It's a direct judicial push to change exactly how local governments categorize, track, and ultimately respond to this illness.
Section 2, defining notifiable diseases. You might be wondering, what exactly does that mean? Well, a notifiable disease is one that must legally be reported to government authorities by medical professionals the second it's diagnosed. Think of it like a massive national public health radar system. If a doctor sees it, they have to ping the radar. And the logic here is simple, but it is incredibly powerful. You just cannot fight a health crisis that isn't even on the map. Without this legal requirement, health officials are quite literally fighting blindfolded.
Section 3, the cancer data gap. Now let's break down the actual mechanics of a disease registry. Why do we need this data? Well, tracking demographics allows authorities to identify vulnerable populations. Pinpointing regional locations maps out geographic disease clusters, like maybe there's an unexplained spike in a specific valley or an industrial town, right? And logging specific cancer types highlights potential environmental or genetic risks that are localized to those exact areas. By collecting these specific data points, the government can spot actual trends rather than just guessing. It essentially transforms isolated medical files into a cohesive, highly actionable heat map of a crisis.
Section 4, how reporting saves lives.
Let's look at exactly how this abstract legal mandate translates into a functional, real-world reporting mechanism. Step 1, a patient gets diagnosed with cancer. Under the new mandate, we immediately hit Step 2. The hospital is now legally required to report this diagnosis to the registry. It's no longer optional, it's not left to chance. And finally, Step 3, the government uses that aggregated data to spot trends and take action. This incredibly simple three-step flow bridges the vast gap between a single doctor's appointment and a massive coordinated public health response.
And we really have to emphasize the stark contrast between late and early detection here. Late detection means fewer treatment options, a much higher mortality rate, and severely strained medical resources. But with early detection, the disease becomes highly treatable. It allows for targeted screening and enables totally proactive resource allocation. Shifting patients into this early detection reality is the Supreme Court's primary objective for this entire ruling. It's an absolute game changer.
Section 5, the next steps. So, what's the ultimate takeaway here? Mapping cancer through this legal mandate leads directly to proactive, life-saving strategies. Because they'll soon know exactly where the clusters are, regional governments can start deploying targeted screening camps right where they're needed most. This leads to a way better allocation of medical resources. We're talking about sending specialists, funding, and equipment to the exact right districts at the exact right time. And ultimately, it means catching the disease when it is most treatable. It's a critical shift from a reactive healthcare system to a proactive one, driven entirely by data.
As we wrap up this explainer, let's turn the lens back onto the broader healthcare system for a second. This mandate absolutely proves how vital organized information truly is. So I want to leave you with a bit of a provocative thought. If data is our absolute best weapon against cancer, what other blind spots in our healthcare system need to be illuminated? Think about the immense power of data transparency. Legally mapping other invisible health crises could completely reshape our world. Thanks for focusing in with me today, and I'll catch you in the next explainer.